Greetings, lovely humans. Welcome to my channel. Let's embark on this journey together. The sunshine vitamin, or vitamin D, is an essential vitamin in order to maintain body health. The body functions of vitamin D are countless. To name a few, it's essential for supporting the health of bones and teeth, the immune system, brain and nervous system, and regulating insulin levels. Unlike other vitamins, vitamin D can be formed by the body when the skin is exposed to sunlight. This is why getting 10 to 30 minutes of daily sunlight exposure is important. However, since nowadays people are spending most of their time indoors, vitamin D deficiency has become common. Yet, despite this, most people have no idea they're low on vitamin D. They tend to suffer the side effects of vitamin D deficiency without knowing the cause. This is why in this video we will reveal to you 10 signs your body is begging for vitamin D. So grab your cup of tea, sit back, and let's dive in and explore together. Number 1, frequent illness. If you feel like you're sick all the time, you might want to get your vitamin D levels checked. Vitamin D is crucial for the activation of immune cells such as T cells and macrophages, which help the body fight off pathogens like bacteria and viruses. T cells are critical in the immune response, identifying and attacking infected cells. Vitamin D is necessary for these cells to become active. Without sufficient vitamin D, these cells remain dormant and unable to respond to infections effectively. This will decrease the chance of you getting sick. One study found that people with low vitamin D levels were more likely to develop illnesses like colds, flu, and more severe conditions like pneumonia. If you suspect you're deficient, it's a good idea to have your levels tested by a healthcare provider and discuss the best ways to address it. Number 2, bone and back pain. Vitamin D is essential for the absorption of calcium in the intestines. Without sufficient vitamin D, your body cannot absorb enough calcium, regardless of your calcium intake. Calcium is the primary building block of bone, and without it, bones become weak and brittle. Not only that, but vitamin D also helps in the deposition of calcium and phosphorus in the bone. This increases the bone density, which makes the bone stronger. In adults, a deficiency in vitamin D can lead to a condition called osteomalacia, where bones become soft due to impaired bone mineralization. This softening of the bones can cause deep, dull bone pain, often in the lower back, pelvis, hips, legs, and ribs. Osteoporosis and osteomalacia share common feature. In these conditions, your bones break easily. A study that involved 360 patients complaining from chronic back pain revealed that 83% of them had vitamin D deficiency. Moreover, vitamin D supplementation led to significant pain reduction in 95% of these patients. Number 3, depression. Most people tend to think that depression can only be attributed to environmental factors in our day-to-day life or major life events. However, depression as a symptom of vitamin D deficiency has been increasingly recognized in both scientific research and clinical practice. Vitamin D receptors are present in many parts of the brain, including areas involved in mood regulation. This suggests that vitamin D plays a role in brain health and cognitive function. Vitamin D influences the production of serotonin, a neurotransmitter often referred to as the feel-good hormone. Serotonin plays a crucial role in mood regulation, and low levels of serotonin are associated with depression and anxiety. Adequate vitamin D helps maintain optimal serotonin levels. If you're experiencing symptoms of depression, especially if they coincide with other signs of vitamin D deficiency, it may be worth checking your vitamin D levels and considering supplementation if necessary. Number 4, fatigue. Fatigue and tiredness can indicate many different health conditions. It would take us an incredibly long time to list them all. Yet, did you know that vitamin D deficiency would be on top of that list? In fact, a 2014 study published in the North American Journal of Medical Science proved just that. In this study, researchers evaluated 174 adults with fatigue and measured their vitamin D levels. 77.2% of these adults were found to have low vitamin D levels. Low levels of red blood cells can reduce oxygen delivery to tissues, leading to fatigue. Talking to a therapist or counselor can help address psychological factors contributing to fatigue, such as depression or anxiety. Number 5, hair loss. Daily hair loss is normal, but if you notice that the rate of your hair loss is more than usual, this can be an alarming sign indicating low levels of vitamin D. Vitamin D is crucial for the creation of new hair follicles. Hair follicles are the tiny pores from which hair grows. When vitamin D levels are adequate, hair follicles remain active and can support continuous hair growth. A 2013 study measured vitamin D levels in patients with various types of hair loss. Vitamin D deficiency has been linked to a condition called alopecia areata, an autoimmune disorder where the immune system attacks hair follicles, leading to hair loss in patches. Significant regrowth of hair was seen once these patients were given vitamin D supplements. It's important to consult a healthcare provider to determine the underlying cause and appropriate treatment. Number 6, impaired wounds healing. Impaired wound healing is a significant sign of vitamin D deficiency due to the vitamin's critical role in various biological processes involved in tissue repair and regeneration. One of the many physiological functions of vitamin D is enhancing the production of compounds that are crucial for forming new skin as part of the wound healing process. Lack of vitamin D equals a subsequent lack in these compounds. The result would be slower wound healing and tissue repair. Vitamin D contributes to angiogenesis, the formation of new blood vessels and healing tissue. These new blood vessels are essential for supplying nutrients and oxygen to the wound site, facilitating repair. Without adequate vitamin D, this process can be hindered, resulting in poor wound healing. This is why impaired wound healing can be a noticeable symptom of low vitamin D levels. It's important to consult a healthcare provider to determine the underlying cause and appropriate treatment. Number 7, muscle pain. Physiologically, vitamin D participates in muscle function and decreases muscle pain by lowering inflammation. This is why prolonged muscle pain can be attributed to vitamin D deficiency. This has been supported by a study in 2014 where researchers evaluated vitamin D levels in 120 patients with chronic muscle pain. It was found that 70% of the patients were found to have vitamin D deficiency. Vitamin D interacts with receptors in muscle cells. These receptors help to maintain muscle strength and function. When vitamin D levels are low, these receptors are less effective, leading to impaired muscle function and resulting in pain or discomfort. Muscle pain can be a significant and early indicator of vitamin D deficiency. It might be worth having your vitamin D levels checked as part of the diagnostic process. Number 8, bone loss. Bone loss and impaired healing are both significant symptoms and signs of vitamin D deficiency, and they occur due to the crucial role that vitamin D plays in bone health and maintenance. As we mentioned earlier in this video, vitamin D is essential for the absorption of calcium from the diet. Without adequate vitamin D, your body struggles to absorb enough calcium regardless of your dietary intake. This is a great importance because your bones are constantly cycling between two processes, resorption and remodeling. Resorption is a process where your bone gets eroded. This bone should normally be replaced through the process of bone remodeling. Over time, this imbalance can lead to conditions like osteopenia, reduced bone density, and osteoporosis, severely weakened bones. These conditions make bones more fragile and increase the risk of fractures, even from minor falls or injuries. If you suspect you have these symptoms, it's important to consult with a healthcare provider who may recommend a blood test to check your vitamin D levels. Number 9, weight gain. Weight gain itself is not a direct symptom of vitamin D deficiency, but it can be associated with the condition in several ways. Vitamin D is needed in your body to promote insulin sensitivity. Without enough vitamin D levels, your body cells don't respond to insulin properly and your blood sugar levels remain high. As compensation, your pancreas starts producing more insulin. The problem is that insulin, besides lowering sugar levels, also promotes fat storage and can lead to weight gain. Some research suggests that vitamin D may influence metabolic processes. A deficiency could potentially lower your metabolic rate, meaning you burn fewer calories at rest, which can lead to weight gain over time. Vitamin D is involved in the regulation of leptin, a hormone that signals to your brain when you're full. A deficiency in vitamin D might disrupt this signaling, leading to increased appetite and overeating, which can contribute to weight gain. When you're low on vitamin D, you might experience fatigue and low energy levels. This can result in a decrease in physical activity, contributing to weight gain since you're burning fewer calories. If you suspect that vitamin D deficiency is affecting your weight or overall health, it's important to get your levels checked and discuss appropriate treatment or supplementation with a healthcare provider. Number 10, respiratory issues. Vitamin D plays a role in lung development and function, making it essential for the growth and repair of lung tissue. For this reason, low levels of vitamin D can negatively affect lung function and development, especially in children, which can lead to lung conditions such as wheezing and asthma. Vitamin D is vital for the proper functioning of the immune system. It helps in the production of antimicrobial proteins, such as cathelicidins and defensins, which have the ability to fight off respiratory pathogens, including bacteria and viruses. And when vitamin D levels are low, the body's ability to produce these proteins decreases, leading to a weakened immune response. This can make the body more susceptible to respiratory infections such as colds, flu, bronchitis, and pneumonia, which is why respiratory problems can be a sign of low vitamin D levels. Addressing the deficiency through supplementation or lifestyle changes can help improve respiratory health and reduce the risk and severity of these issues. So these were the top 10 signs. You can get vitamin D through sunlight exposure, fortified foods such as milk, orange juice, and cereals, fatty fish like salmon and mackerel and egg yolks. If you can't get it adequately from your diet, it's recommended you take vitamin D supplements. A blood test will help you know whether your vitamin D levels are normal or low. Now, we want to hear from you. Have you ever experienced any of these signs before? Was the cause vitamin D deficiency? I want to take a moment to thank you for watching my video. Your support is invaluable, and I am incredibly grateful for each and every one of you.